Bismillahirrahmanirrahim. Dear ladies and gentlemen, thanks to your attendance of this session. First of all, I want to thank to Universitas Pancasila, Directorate General of Higher Education and Culture of the Republic of Indonesia, and Live DNA for supporting of this research and founding this conference. And also thanks to ICSTM Committee for inviting me as oral presenter. At this session, I am presenting about bioavailability study of curcumin nanoparticle as sustained-release delivery system. I am Novi Yantih, and I collaborated with Denny Rahmat, Felix Sexioteng, and Yuna Harafarida in this research. Various in vitro and in vitro studies have shown that curcumin has many pharmacological activity. There are as anti-inflammatory, anti-diabetic, anti-cancer, and anti-aging. Curcumin has low solubility, poor absorption, and low bioavailability. Bioavailability refers to the extent and rate at which the active substance of the drug product reaches the systemic circulation. In this research, we prepare the curcumin nanoparticles and compare their bioavailability with non-nano-sized curcumin. This study has proven that the form of nanocurcumin can improve its absorption. It can be seen from its bioavailability. Through this bioavailability study, it was also possible to observe a curcumin delivery system with sustained release. Bioavailability studies were carried out on white males breakdown rats, and determination of curcumin levels in rat plasma were performed by HPLC. Bioavailability profile was formed from the curve of the relationship between plasma curcumin concentration and time. The objective of research were formulate curcumin into nanoparticle based on ethyl cellulose cysteamine as a delivery system for increasing the absorption of curcumin to obtain a comparison of pharmacokinetic parameters such as Cmax, Tmax, IUC, and half-life. Nanoparticles of curcumin based on ethyl cellulose cysteamine to non-nano-sized curcumin in rat plasma, and then to compare the sustained release delivery system in rat. Formulation of nanocurcumin. We prepare the curcumin and ethyl cellulose cysteamine nanoparticle curcumin preparation from thiomer of ethyl cellulose cysteamine. This is the characterization of curcumin nanoparticles. They were particle size, polydispersity index, zeta potential, loading capacity, absorption efficiency, and morphology. Based on the research result, obtain nanoparticle size that meet the range 1 to 100 nanometers. With these submicron size particles, drug delivery can occur with a control release target so that the drug acts directly at the site of action. Zeta potential characterization aims to determine the nature of the surface charge and stability of nanoparticles in colloidal dispersion, and the size of the charge of nanoparticles dispersed in the dispersing medium. Based on the research results, curcumin nanoparticles based on ethyl cellulose cysteamine have a zeta potential of minus 0.30 millivolt. With near neutral charges, nanoparticles can increase drug permeation in mucus. Negatively charged nanoparticles give a higher cumulative amount of drug in nanoparticles than positively charged nanoparticles. In addition, negatively charged nanoparticles interacted less with mucin due to repulsion, so that nanoparticles migrated more easily to the intestine. The particle morphology shows the spherical shape of the nanoparticle. With a spherical shape, curcumin nanoparticle based on ethyl cellulose system in thimer showed stable properties and were thought to not experience aggregation during storage, so they could become a more effective delivery system. This is bioavailability test in rat. We carry out acclimatization rats for 7 days, and then rats divided into 2 groups, curcumin nanoparticles group and curcumin group, and then curcumin nanoparticle solution and curcumin solution at dose 100 milligram per kilogram body weight were administered to rat orally, and then we collect the rat blood samples were taken at 0, 30, 60, 90, 120, 150, 180, 240, 300, 360, and 900 minutes through the orbital sinus of the A. All samples were stored in an appendage tube at minus 20 degrees Celsius before analyzed by using HPLC, and then we calculated the concentration of curcumin at each sampling time to make bioavailability profile. This result approval of ethical clearance by Health Research Ethics Committee UPNVG. And analysis curcumin in red plasma by high-performance liquid chromatography use was the isocratic system in the reverse phase of the C18 column. The mobile phase was acetonitrile, acetic acid, and water at a flow rate of 1 milliliters per minute, and detectors were carried out at a wavelength of 428 nanometers for curcumin. The lower limit of quantification of this method was 0.02 microgram per milliliters. And this is chromatogram of curcumin and curcumin in red plasma. We can look at this picture. The retention of curcumin were about 5 minutes. Partial validation of HPLC method was carried out 5 replication for linearity, accuracy, and precision tests. There was a curve calibration with coefficient determination of 0.9942, and accuracy that shown differentiation when not higher than 20% in lower limit concentration in 0.0 to 1, and then not higher than 15% in others concentration. And also the coefficient of variance were not higher than 15%. That's been the method was accurate and precise. And this is the recovery of curcumin in red plasma analyzing by HPLC method. Okay, that is the comparison of bioavailability of curcumin and curcumin nanoparticles. We can look at this picture. The bioavailability profile of curcumin in the blue one and the curcumin nanoparticle in the red one. We can see there were three peak of the bioavailability profile of curcumin. Curcumin nanoparticles were able to increase the concentration and amount of drug absorbed and maintains concentration with a sustained release effect. The purpose of this sustained release is to keep the drug concentration constant, not to give a large concentration directly. The peak of the graph will wide so that the concentration remains in the therapeutic range. The potential effect of the sustained release is in accordance with Budi Tomo's research. This is the comparison of pharmacokinetic parameters of curcumin and curcumin nanoparticles. We can see that the parameters were Cmax, Tmax, the IUC, IUCT to infinity, IUC 0 to infinity, half-life, clearance, and distribution of volume. IUC 0 to infinity and Cmax are the most relevant parameters for drug bioequivalence assessment. Cmax at the first of Tmax were not significant different between Cmax of curcumin and curcumin nanoparticle. But the other side, the Cmax at second and third Tmax and IUC 0 to infinity and IUC T to infinity from curcumin nanoparticle and curcumin were higher than 125% with the confidence interval of ratio of 95%. The calculated T value for Cmax at the first phase was higher than 0.05, which indicated no significant difference. While at Cmax at the second and the third peak times, Cmax of curcumin and curcumin nanoparticles had a significant difference. It showed that curcumin nanoparticles was bioinequivalent with curcumin. By modifying the particle size into nanoparticles, there is an increase in curcumin levels when compared to conventional curcumin. Okay, that is the conclusion of our research. First, curcumin nanoparticles form spherical with a zeta potential of a minus 0.30 millivolt, and then the curcumin nanoparticles formulation had better bioavailability than curcumin, took the improvement of pharmacokinetic parameters and the sustained release properties of curcumin nanoparticles. Thank you very much for your attention, ladies and gentlemen.